Welcome to the Knee Longevity Series. I am your host, Dr. Theresa Larson. I'm a Marine Corps veteran and a doctor of physical therapy. What are you going to learn here in this video series? You're going to learn about managing knee discomfort. Who gets knee issues? How do you manage your knee discomfort? And what time of day is best for you to move? Fun fact, the knee joint is the largest joint in our body. Here's the thing. Knee discomfort is a common complaint for most people, especially veterans, active duty military alike. Here, we offer some information on knee discomfort to decrease the mystery and fear associated with this common condition and empower viewers, like you, to take action through regular movement routines and self-care habits that support lower body longevity and musculoskeletal health. Self-care is your best version and form of healthcare. So who gets knee discomfort? Many people will experience knee problems, and about 25% of adults over the age of 55 will have knee discomfort at least once per year. Unfortunately, for many people, knees are an anatomical mystery, and there are a lot of uncertainty about what's safe for the knees and protective against long-term dysfunction. This alone can result in years of hearing friends and family lament the loss of their ability or function due to their bad knees. And their fear of knee problems can get in the way of doing things that are meaningful and that they love. There are both factors we can control and those we cannot, like genetics or old injuries, when it comes to risk factors for knee problems. But we're going to focus on all of the factors you can control in order to empower you to make positive changes in your life. High-level research indicates that the biggest factor influencing onset of knee issues is being overweight or obese. This may be related to both the greater total load on the joint as well as emerging evidence that osteoarthritis, a common cause of knee discomfort, may be an inflammatory condition rather than a wear and tear condition. What this means is that we can use holistic strategies to decrease inflammation like sleep, nutrition, and movement to both manage and prevent knee problems. Equally important to address and also well within our control are the psychological risk factors for knee discomfort, including depression, anxiety, coping by avoiding discomfort, catastrophizing, such as thinking in worst-case scenario terms, and the tendency to have stress appear as a bodily dysfunction. This is important because it means that if we have better understanding about how our thoughts and mental health affect our joint discomfort, and we address our mental health, we can make changes that will allow us to move more confidently in our bodies. So how do you manage tightness and keep your knees healthy? That's a really good question. Well, the answer is movement. Our bodies need to move. We're born to move. And physical therapists use the phrase motion is lotion to simplify all the benefits of movement that it gives us, including blood flow to the muscles, which is like nutrients to muscles that support the knees, and lubrication for the knee joints themselves. It is important to combine both strengthening and aerobic exercise for musculoskeletal health, and do not limit yourself to only activities that feel comfortable. If we pull back too much, we can end up losing our strength that normally supports our joints and might feel worse as a result. While it might seem counterintuitive, exercise in combination with diet has actually been proven to prevent knee osteoarthritis. In addition to exercise, working on sleep, length and quality, nutrition, and mental health are the other pillars to building resilient and healthy knees. And you can learn more about each of these by looking at the rest of the video series. So here's the other thing I want to talk about. When is the best time to move? Often our joints, tendons, muscles will let us know when we need to move, usually through sensations of muscle tightness, dull aching, or muscle cramping, or even joint stiffness. But it is a good practice to get moving before our bodies start to complain. Every 25 minutes is a good rule of thumb. Set an alarm. Many people notice tightness during long car rides or after sitting or standing for long periods of time. This is normal, but tells us that we need to move more frequently or more consistently. It can be helpful to get moving first thing in the morning since our bodies have been relatively still all night, and even moving gently before bed, which can help us down-regulate, aka calm down, and de-stress from the day. Movement doesn't have to be complicated, and it doesn't have to take more than a few minutes. And we all have a few minutes to feel loosened up and energized. So check out this video series for several knee-specific strength and mobility exercises led by me. You got this.